I don't care what I have to do. I said, I will get this treatment in a dumpster if I have to. I said, I want this treatment. I want it so badly.
Wild horses could not keep me away from one of these clinics. Absolutely.
Diabetic patients finally have an answer, and it's called Trina Health. Trina Health clinics use APT, which stands for Artificial Pancreas Treatment. This treatment was developed by Ford Gilbert, whose daughter Trina was diagnosed as a type 1 diabetic in 1985 at the age of 2. That's when Mr. Gilbert gave up a successful career as an attorney and began researching a way to improve his daughter's life. Now his journey is complete. APT is FDA cleared, and there are a handful of Trina Health clinics across the country helping type 1 and type 2 diabetics properly metabolize carbohydrates, thus regaining a normal life.
When we start a clinic, these people, it's incredible, they're almost resurrected. You see a very, very sick patient come in, and by the time we're done with them in just a few months, they're well. When I first started, my therapeutic goal was to stop my daughter from having these wild excursions where she would go into the hospital, she'd become diabetic ketoacidotic and things like that, and be hypoglycemic, her blood sugar go way up and get sick and way down. That was my goal. But once we started normalizing the liver functions, if you will, one of the accidents was the complications of diabetes started reversing. All we do is by mimicking the pancreas, we restore carbohydrate utilization. So our patients can burn carbs.
As a diabetic, I know that this disease or a complication thereof is going to kill me. This will be my undoing. If I can stave off that inevitability to the best of my ability, I'm going to, and this is the answer.
Doctors told me because my diabetes was so out of control, I was not able to have children. And I was at the time with someone and we were trying to get pregnant, and I just was not able to ever get pregnant. And I started the treatment, and about, I don't know, a year later, I have a son. He's 9, he'll be 9 this May.
An APT treatment session, like this one being performed at the Trina Health Clinic in Scottsdale, Arizona, lasts 4 to 6 hours and is administered every 7 to 10 days. The treatment is painless, and while undergoing it, patients can read, watch television, or even sleep.
We're looking at not just the medical side, but we're also looking at all these other ancillary issues that go along with diabetes and trying to treat, the whole patient and put them back on their feet, because a lot of them have really stumbled, and those are the ones that we're really looking to help, are the ones that are stumbling.
They're finding phenomenal things with this. They're finding that the diabetic with different diseases, not only is the diabetes doing better, but so is the whole body.
These patients sleep well now. They never slept well before. They feel good, they have energy, their wounds heal. If they have kidney problems, that stabilizes. If they're on dialysis, they do better. When we bring these patients back, they go from feeling poopy and just down here somewhere, or wherever that is, to all the energy and all the mental acuity and all the happiness of feeling good. You have no idea how remedial this therapy is. Nobody does until they see it. And we do things that I would never, ever, ever believe. And we have never had a single adverse reaction.
Any diabetic, type 1 or type 2, knows that as soon as they were diagnosed, their life has shortened. APT is going to give them the life that the disease wasn't going to let them have.
Trina Health, the treatment, it has saved my life, and it's made it so I will live long enough to hopefully see my son's kids.
The turnaround in my health and in my outlook on life has been absolutely tremendous. I can't be more excited about being a part of this process.